Okay, so what if we told you melatonin could help with more than just a better night's rest?
Yeah, now we have your attention, right?
Yes, we do.
Researchers just found melatonin is linked to slowing the progression of age-related macular degeneration, which could also lead to glaucoma and vision loss.
Fascinating. According to a study by Medscape, melatonin use reduces the risk for age-related macular degeneration by 58%. That's a big number.
Yes.
It also found the findings were consistent among age groups, meaning melatonin could benefit older people with a higher risk of losing their vision.
All right, so now we've got that out of the way. Let's talk more about this because a lot of people are probably really excited to hear this. Here with us to discuss this phenomenon is Dr. Richard Chu, ophthalmologist and medical director of the Chu Eye Institute. Dr. Chu, thank you for being with us on Morning on Merritt Street.
Hi, guys. Thanks for joining. Thanks for having me.
Absolutely. Okay,
Yeah.
First of all, let's break this down. What is melatonin and how is it benefiting in this spectrum? How does this relate to our eye health?
Yeah, melatonin is a naturally occurring hormone in our body. It's produced in our brain, and like you said, the researchers at Case Western found that it actually helps benefit our eyes and our macular degeneration too. It's antioxidant and anti-inflammatory. So they found that it can reduce the chances of macular degeneration. It can reduce the chances of developing glaucoma and also dry eyes in long term.
Wow. I mean, the results are fascinating, and I'm curious. I take melatonin for sleep, so I'm wondering how much melatonin was used in the study. It comes in different milligrams and strengths. And then how much should people start taking if they want to use it to improve their eye health?
Right. So melatonin in the study, it was a retrospective study. So it wasn't a prospective study. They didn't have a specific dose. They just analyzed 100,000 charts and found that the people that take melatonin have a less chance of developing macular degeneration compared to the ones that didn't take melatonin. So it wasn't a controlled study like what we're used to seeing. Typically, I would recommend that you start off with 1 milligram. You kind of ease into it, and you work your way up to maybe 3 or to 5 milligrams, and wouldn't go higher than 5.
Well, with this not being a controlled study, like you said, we're typically used to seeing, let's talk side effects because there's always side effects when you consider taking anything new. If people do want to take melatonin, say for my eye health, is there a risk and what should we be aware of?
Great question. Absolutely. Melatonin is very safe medicine because it's a naturally occurring in our body. With everything, I always recommend you talk to your healthcare quarterback or your primary care doctor to see if it interacts with your medicines that you take, like including the biggest ones that we think about are warfarin and which is a blood thinner that is very popular. High blood pressure medications because melatonin can decrease your general blood pressure, and also if you're on any antidepressants like Prozac, because melatonin can increase your serotonin levels. If you're starting to take it, I would definitely source it from a reputable source, meaning that a brand that you trust and that has independent reviewers that look at the quality of the melatonin and also if there's any other additives in the melatonin. Sometimes melatonin also supplements have serotonin in it, and that can be dangerous if you have too much serotonin in your body, or if there's any heavy metals in the supplements too. So all these good things are to consider before you start taking it.
Right. And Dr. Chu, based on the results that we've seen from this study, is this something you're going to recommend to your patients?
Absolutely. I think the study shows strong evidence that melatonin definitely helps the eye health, and especially with people with glaucoma and macular degeneration. As long as they're safe about it and they understand the side effects, I think melatonin could be very beneficial to the eye. Having said that, the study is, like I said, not a prospective study; it's a retrospective study. The evidence is strong, but not conclusive. So, there needs to be a lot more study done before we really say that melatonin for sure can help macular degeneration.
Dr. Chu, let's talk a little bit more about macular degeneration. Are there any other factors that could increase our risk for developing macular degeneration?
Yeah, macular degeneration is the most common leading cause of blindness in America. especially in our older individuals. The biggest studies that we look at are the AREDS, the age-related eye disease study. Those were done by the National Eye Institute, NEI, back in the 90s. And basically, they look at oxidative stress on the macula. So there's a formula called the AREDS vitamin, and that's like Ocuvite Preservision that has vitamin A, C, E, zinc, and copper in it, and xanthine, lutein. And those help slow down the risk of macular degeneration or the progression of macular degeneration about 25%. The other thing that they found out in the ARED study is that smoking is the biggest risk factor for macular degeneration. So I talk to all my patients about smoking cessation, substituting smoking with like nicotine patches or gums, really to kick that habit.
Yeah. Well, Dr. Chu, I can tell you this has been really encouraging, very eye-opening when it comes to this topic. Thank you for your medical expertise this morning. We appreciate it so much.
Thank you, Dr. Chu.
I appreciate it. Anytime, guys.
All right.
Thank you.